Okay. So when you're assessing the lumbar muscles, sometimes in some of the presentations you guys do, you're kind of just like, okay, I'm assessing, I'm just kind of pushing. What are your thoughts on that? What kind of information can you gather from that? Okay.
No idea.
Right, yeah, like really, I mean, maybe if it's really, really guarded. But do you remember in lab how thick that musculature is? So if you want to actually feel it, use your fingertips and really dig down into them, because it shouldn't be painful. If like in normal muscle torquer, I can push on their forearm muscles and it's not painful. You feel pressure, but it's not painful. So it should be the same thing. So you're not hurting them. I mean, you start out with a little bit of a little pressure and then kind of dig into it, but don't be afraid to really get in there and feel those muscles. Okay, and then you'd want to move along the spine, so you're also feeling, actually, if we put next slide, you can see the picture. Yeah, so the spinalis is going to terminate before the lumbar spine, but the longus and iliacostalis is still going to have branches. There's going to be a little bit more lateral, that's more the lateral muscle bulk, and then you'll have the multifidus that's right up next to the spine. Okay, we'll talk about that one a little bit more in a minute. But just general palpation, be sure to use those fingertips and really dig into those muscle bellies to look for trigger points, okay? So you'll do that bilaterally. All right, so there's also QL. Where does QL attach?
Superior.
12th rib, iliac crest, transverse process, lumbar spine. Right. I'm gonna lower down just a little bit. Okay. But it's still pretty deep, right? Pretty deep in there. So you really have to go past that soft tissue to get to those muscle bellies. And then if you want to confirm, can you actually hike your hip up a little bit? Yep, and it pops right into my finger, and then relax. I mean, that might take a little bit of cueing, but if you feel like you're not sure if you're on it, always use the muscle's action to confirm. Okay. And then you can go the other side. But see how far in I'm going? Okay. Remember the same thing with the psoas, and that's another muscle that we can definitely assess because of its attachment to the lumbar spine. Remember how deep you go in? Do you want me to show that one again, or do you guys remember from the hip?
Sure.
Yeah. We'll see you again real quick. Okay, you turn yours. On your back. Make sure your knees bent. So remember, my palpation is going to kind of go in medially. Okay, and then when I think that I'm on it, I'm going to confirm with hip flexion. Yep, and then relax. It's a little tender. Yep. Okay, and then from here I can also get to iliacus. Sorry. Okay, and you compare that bilaterally, but okay. So, I want you guys to go through the lumbar paraspinals, the multifidus, and the QL.